Today, the topics we will be talking about for our vital signs monitor will be the functions of the device, the different vendors, costs and margins, the models, the locations of use, the types of monitors, and some advantages and disadvantages. So the functions of the device are that the cardiac monitors record the electrical activity of the heart, so like an ECG. They also help with recording symptoms and detecting and diagnosing different heart conditions. They also monitor blood pressure, pulse rate, oxygen levels, body temperature, and respiratory rates. And you'll use different cardiac and vital signs monitors when the patient experiences chest pain, dizziness, lightheadedness, and confusion, heart palpitations, rapid pulse, shortness of breath, and weakness, fatigue, and decreased ability to exercise. So the types of monitors include a bedside cardiac monitor or a vital signs monitor, and this is typically what you see in hospital settings and like the ER and different rooms in the hospitals. And this is continuous monitoring of cardiac activity and vital signs. You also have Holter monitors, which are wearable devices that you typically wear for 1 to 2 days that have continuous monitoring. And then from there, you can move to event monitors, which are portable devices that record at certain times, typically over a period of 30 days, and you normally push a button to start the recording. And these include loop memory monitors, symptom event monitors, patch recorders, and implanted loop recorders. So some advantages of the vital signs monitors are they help record symptoms that do not occur every day if worn over a period of time. And this helps you detect and diagnose different heart conditions, such as irregular heartbeats, arrhythmias, blocked or narrowed arteries, like coronary artery disease, if you have had a previous heart attack, and how well treatments are working. So, like an example would be a pacemaker. It also reduces manual errors of taking different vital signs, and it also alerts medical staff to when levels fall below what is considered safe. And some disadvantages of the vital signs monitors are that they can cause skin irritation where patches are placed and where the electrodes are adhered to the skin. And it can also be hard to keep the electrodes stuck to the skin if the patient is sweating or if they're moving around a lot. And the signals can also be disrupted through things like the cell phone, electrical blankets, electrical toothbrushes, high voltage areas, magnets, metal detectors, and other devices that have signals that could potentially block it. And it is recommended to keep these at least 6 inches away if you can avoid them.
The market for vital signs monitors in the US is quite competitive. It mainly consists of larger companies such as the ones listed, which are located in places inside and outside the US. For example, Nihon Koden Corporation is a leading Tokyo-based manufacturer, developer, and distributor of medical electronic equipment, such as EEGs and patient monitors. On the other hand, GE Healthcare is an American medical technology company that spends $1 billion annually on R&D and product investment, and their products have served over 1 billion patients annually. The price range for just a vital signs monitor and no other accessories is roughly $1,000 to $2,000 USD. However, prices can deviate from this range due to the company's pricing and different specs they may have. The combination of the prices and the integral role of vital signs monitor places its market value at 7.2 billion USD in 2022. However, as time goes on, there is an increasing demand for this device due to factors such as the increasing prevalence of the aging population. This contributes to an expected market value of 11.21 billion USD in 2028, or a 7.62% compounded annual growth rate. One example model of vital signs monitor is the 7-inch portable advanced vital signs patient monitor by COIL. The list price is $760 USD, and is advertised for both clinical, patient, and home healthcare. Another example is the Mindray VS9 vital signs monitor that has several configurations that can heavily impact its list price. Their cheapest configuration of 1000 USD only has non-invasive blood pressure and pulse rate, whereas their most expensive configuration has only a few additional functions, which raises the list price to nearly 4,500 USD. Now, vital signs monitors, such as the ones I have previously talked about, are commonly used in hospitals, clinics, emergency rooms, ambulances, and nursing homes. These places are filled with patients in which monitoring their vitals are important for providers to do their jobs effectively. However, there are cases in which patients do not need to be monitored, but are not subjected to those places, such as remote monitoring.
We will tackle about the patient monitoring system based on Canada's research. We will tackle the definition, its types, the common brands used here in Canada, like the GE Healthcare and the Philips Healthcare. And we will also discuss the advantages and its advantages, the patient population and setting, and the cost and battery operation. Patient monitoring system. It is continuously measures and records vital signs, aiding healthcare providers in making informed decisions and improving patient care. It includes devices for vital signs monitoring and a wearable device measuring temperature and pulse rate via fingertip. The device records data and interfaces with a PC via microcontroller. The types of patient monitoring system. Patient monitoring systems can be categorized into several types, including bedside monitors, wearable monitors, telemetry systems, and remote patient monitoring systems. For the bedside monitors, these are fixed systems used in hospitals to continuously monitor vital signs and other physiological data. Wearable monitors, portable devices that can be worn by patients, allowing for continuous monitoring without restricting the patient's mobility. Telemetry systems, wireless systems that transmit data from patient-worn sensors to monitoring stations, enabling mobility within a certain range. And remote patient monitoring systems, these allow for the monitoring of patients' health status outside of conventional clinical settings, often through mobile medical devices that send data to healthcare providers via the internet.
We have the common brands of patient monitoring systems used in Canada. This is according to Modern Intelligence. We have GE Healthcare, Philips Healthcare, Abbott Laboratories, Massimo Corporation, Boston Scientific Corporation, Becton Dickinson and Company. So we have the advantages of the GE Healthcare CareScape Canvas monitors. First, we have the advanced capabilities with simplification. This means that it has a 60% reduction in user errors in simulated use testing, 26% reduction in patient transported time, and also you can choose software packages and algorithms specific to each care area with flexible hardware choices and additional displays. Next is the proven clinical excellence. 81% false alarm reduction, 29% reduction in sevoflurane usage, and there's also a 40% reduction in ICU length of stay for ventilated trauma patients. Next is the intuitive and easy to use. 93% agree that GE's implementation of touchscreen sensitivity makes system rapid to use, and it also has a 24% easier to learn and familiarize in simulated use testing. Next is the helping reduce false alarm. CareScape monitors integration to alarm notification solutions. It ensures alarms are available. even when they are needed handheld devices to the clinicians. It reduces non-actionable alarms, helps to decrease alarm fatigue. Next is the enterprise connectivity for improved efficiency. According to the literature, clinical intelligence from multiple sources like the telemetry systems, lab results, medication, and information system can be brought directly to the bedside. Aggregating this information on the CareScape network may enable other sources. And lastly, we have the cost-effective and secure solution. CareScape Monitor software can be updated quickly, and monitors can be serviced remotely, reducing the cost of support and maintenance. It also helps prevent outages and improving uptime. Every monitor runs a proprietary hardened operating system that mitigates the threat of viruses and other malware transported to the hospital network. So we now have the cost of one monitor. Specific model of a GE CareScape monitoring system such as the B40, it usually costs around 4,295 Canadian dollars. As for its battery operation, each battery have one lithium ion and it can operate up to 5 operating time. For the patient population, those are individuals who will benefit from the patient monitoring system from the GE Healthcare. First, we have the neonates, those who are newborns, pediatrics, such as the children, and the adult, from the young adult up to the older age. Next, we have the healthcare setting. These are the units or the special areas that the patient monitoring system from the GE Healthcare are commonly used. We have the emergency room, critical care unit, intensive care unit, post-anesthesia care unit, neonatal intensive care unit, and also intra-hospital transport.
The advantages of Philips IntelliView Patient Monitor includes powerful monitoring and essential measurements in a compact package for a variety of care settings, highly flexible screen configuration, it is easy to use, stores up to 8 hours of data, it is lightweight, hemodynamic extension, capnography extension, wired and wireless connectivity, and it's also touchscreen. As for the patient population, we are using it with neonates, pediatrics, and also with adults. And for the healthcare setting, we are using it in immediate care, special procedures, lower acuity environments, and also with patient transfer. For Philips IntelliView Patient Monitor, it costs 3,095 Canadian dollar and the battery operation lasts up to 5 hours with dual lithium-ion batteries. The disadvantages of Patient Monitor includes reliability, especially when the monitoring systems encounter issues in places with unreliable electricity. Regular maintenance, because these systems can degrade, therefore scheduled maintenance is necessary to ensure their continued functionality and availability. Third is the cost. High-quality vital signs monitor can be expensive to purchase, maintain, and calibrate. Fourth is alarm fatigue, and lastly, accuracy.